This is Sarah Baroni, and I am doing my blood administration for critical care. I have all my supplies printed, so you're going to need clean gloves, 500 milliliters of normal saline, your blood bag, your blood tubing, alcohol swabs, saline flushes, and your bio bag. So you're going to do your pre-procedure checklist. So you're going to go into the patient's room, knock, introduce yourself, wash your hands. You want to verify that you have the right patient using two identifiers. You want to ask them if they have any allergies. Um, you do also want to explain the procedure to the patient. That way they understand what's going on, what's going to happen. Answer any questions that you have. Do all of your patient teaching and patient education at the bedside. And then make sure that the bed is in the lowest position, the brakes are on, do your environmental checks. And then you're going to go and gather the supplies. So everything that I have here. Make sure that you check the doctor's orders to make sure that you have the correct patient and the correct order. And then you do need to get a second nurse because you're going to have to compare the blood bag label to the patient's ID band as well as the blood form that you receive from the blood bank. So before you do any of the other procedure, you'll head back to the patient's room. You'll provide them with privacy, do your hand washing, and introduce the other nurse that's coming in. And then you want to take your blood bag and check the label and make sure that the label matches the patient's ID band as well as the form that you got from the blood bank that comes with this blood unit. So you make sure that you have the correct patient, the correct blood, and then you are good to go. So you want to wash your hands and put on gloves. Make sure that we provided the patient with privacy. We want to check their IV site and make sure that it's patent. So what you're going to do is take an alcohol swab and rub down that hub, and then you're going to inject a saline flush just to make sure that you have a patent IV tubing. And then you're going to take your normal saline and hang it. That way it's ready to go. What you also want to do is you're going to spike the bag of normal saline, and then you need to make sure that you filter out all of the air bubbles that are coming from this tubing because we don't want any air bubbles to get into the patient and cause any adverse reactions. And then what you'll do is you'll close that clamp. So let it come all the way out so there's no air bubbles, clamp that off, and then just set that to the side for a minute. Then what we're going to do is take our Y tubing and we're going to spike our blood bag. And we need to make sure that we prime this tube as well. So no air bubbles, same thing as the normal saline, no air bubbles. And then we're gonna connect this Y tubing. After it's all connected, we're gonna connect the end of it to the actual patient's IV site. And then we need to set up our pump. So we need to make sure that for the first 15 minutes, we can't deliver any more than 2 milliliters in 15 minutes. We're checking to make sure the patient doesn't have any adverse reaction to this blood. And if they do, we need to stop the blood transfusion immediately. And then you're going to just monitor them. You will take their vital signs, so make sure that there's at least a blood pressure machine in the room. If not, you need to get that with all of your supplies before you come into the patient's room because we do need to monitor, like I said, for any adverse reactions. And then once we have that blood going for the first 15 minutes, we can increase the rate of the transfusion if that's what the doctor's orders say or whatever your hospital or facility protocol is. Then you can increase that infusion as long as the patient is tolerating the blood and they're not having any adverse reactions and you're following the MD order or your facility protocol. And then you want to go back and take another set of vitals after the infusion's complete. So when the infusion's complete, we'll stop the pump, make sure that this is clamped, And then we'll take a whole set of vitals just to make sure the patient is stable, make sure that all the, blood pressure, heart rate, everything looks within normal limits. And then we can disconnect this Y tubing from the actual patient's IV site. And you're going to want to alcohol swab that hub one more time and do another normal saline flush just to make sure that everything is inside of the patient, and also make sure that the IV site is still patent. And then you will just discard all of your tubing, your bag. It needs to go into the proper bin. So the bags usually this bag usually goes into another special container unless your hospital facility has, they want it in the bio bag. But usually you put this into a different bag or a different bin. And then what you can do is position the call light within reach, let the patient know that the procedure is finished and that if they need anything, they could push the call light, place the bed in the lowest position possible, and then you're going to document the procedure, document if there was any adverse reactions from the patient, and then discard everything into like a separate bio bin, which is usually either in the patient's room or in a like dirty utility room. Wash your hands after the procedure, and like I said, make sure to document everything, especially if the patient had an adverse reaction and you needed to stop the infusion. And that concludes my blood administration.